Welcome everyone to the Community Eye Health webinar for seniors. My name is Nicolette Torcello and I'm from the Vision Initiative and I'm the Health Promotion Officer. And you'll see some of our panelists. That's Jackie Barry, she's the Vision Initiative Program Manager, and also present with us is Mark Di Paola. I would like to acknowledge the traditional owners of the land we are meeting on today. I pay my respects to elders past and present and to young and emerging Aboriginal and Torres Strait Islander leaders. Just a little bit of housekeeping. You are on mute and your camera is turned off. You'll have opportunity to ask questions via the Q&A section. And if you have any technical questions, put those in the chat box. At the end of the presentation today, we'll be sending you a short survey. And if you should have any technical issues, please take note of that mobile number and call that number if you've got any problems. That number is also in the chat. Just a little bit about the Vision Initiative. We are an eye health program in Victoria, and we are funded by the Victorian Government and managed by Vision 2020 Australia. We have a number of partners, as you can see on the screen, and they are professional bodies or research organisations. You're probably going to be most familiar with the guide dogs there in the middle. So we work very closely with a whole range of organisations. Just a little bit of a rundown on the presentation today. We'll be covering vision loss and the main causes in Australia, how to protect your vision, low-cost eye care services, COVID-19 and the impact on eye care services, and information and support services that you might find useful. We'll have an opportunity at the end of the session to ask questions and answers. However, please note that we really can't answer any personal medical questions or give you personal advice, but we're more than happy to answer any general questions. We would like to ask you this question. When was your last eye test with an optometrist or an ophthalmologist, which happens to be an eye doctor? And in front of your screen, you'll see a couple of options. Choose the one that most relates to you. When was your last eye test? So here we've gone, we've got the results. Quite a number of people said less than 1 year ago. A small number said between 1 to 2 years, and some have said between 3 and 5 years. And unfortunately, no one says more than 5 years ago. So thank you for sharing that information with us. Just a little bit of statistical information. There are more than 453,000 people living with low vision or blindness, and there will be more than 1 million people over the age of 50 by 2050. However, there is good news, and most blindness and vision loss is preventable or treatable if detected early. So that's extremely good news. I'd like to now take the opportunity to introduce our presenter, Mark Di Paola. He is an optometrist and the director of the Graham Hill Eye Care, a very large eye care clinic in Shepparton. Mark graduated from optometry at Melbourne University in 1996. He started working at Graham Hill Eye Care in 1997 and took ownership in 2017. Mark represents the profession on the Victorian Optometry Association Advisory Committee. He has 3 teenage children and loves tennis and cycling. So I would now take this opportunity to hand over to Mark.
Thank you very much, Nicolette. Thank you to you and to Jackie and the Vision Initiative. Greatly appreciate the opportunity to talk about the importance of eye health. And I think this is a really appropriate day for us to be having this conversation. Of course, in Victoria, we're celebrating being out of lockdown after having 5 days of being locked at home. So it's during these times where we need to be aware of getting back into the rhythm of getting organised with appointments and things that we've been holding off of and get back organised with. You can see a photo there of our clinic in Shepparton. We've got a large regional optometry clinic with 5 full-time optometrists. So I'll be talking today about eye conditions that we see every day and help people manage. And I'll be happy to take questions on other conditions as well. But there's 5 in particular that are responsible for the majority of vision impairment. You mentioned, Nicolette, about the number of people with vision impairment. It's worth just mentioning what the definition of vision impairment is. And we tend to think of vision impairment as someone with vision loss significant enough that, for example, it means that they would no longer pass a driving standard. So these are factors that have a big impact on people's lives and their independence. And so it's, of course, terribly important that we do everything we can to make sure that we limit the amount of eye disorders that go on to have that impact on people's lives. The 5 to talk about today are age-related macular degeneration, cataracts, diabetic retinopathy, glaucoma, and the need for glasses. So Nicolette's already mentioned that how important it is to have good eyesight, and the research tells us that most people in the community feel the same way. That you can see from the statistics here that the majority of people would feel that eyesight is a really important sense. We also know from other healthcare statistics that people would consider blindness or cancer their most fearful health conditions that they would most like to avoid. And so the key message today will be, if you get checked on a regular basis, you're doing the best thing you can to be not in that category of being at risk of poor vision. The other thing to note is the way this photograph demonstrates is just by looking at someone or looking at yourself in the mirror, there's no way of being able to tell whether these eyes have got eye disease or not. So this is someone who might have macular degeneration in one eye and very poor vision, but quite good vision in the other eye. There's no way of being able to tell that by looking at someone else or looking in the mirror. The eye examination is essential. So who's at risk of poor vision? Well, we know that, like a lot of health conditions, eye conditions are far more prevalent in age groups of 40 and over, and certainly with each decade, those conditions become more common. And Nicolette mentioned the statistics of the amount of people we're expecting to have vision impairment by 2050. That's by and large mostly because of the amount of people we're going to have in Australia in their 70s, 80s, and 90s by that year. We also need to recognise that there are certain groups who do have barriers to having an eye test, and it's people who live in remote areas, Indigenous Australians, and people who don't have English as a primary language. We need to be doing our best to make sure that we're making the services as easy to attain as possible for those people. So just in terms of a basic anatomy lesson, this is a photograph, of course, of the front of somebody's eye. I'm sure you're going to be all quite familiar with most of these structures, the eyelashes and lids, the iris and the pupil. What's worth noting here is that the pupil is actually a clear window into the eye. So if we think of the eye as working like a camera, the pupil is like the aperture to look into an eye. So the reason why we look at pupils and they look black, it's a bit like looking into a cave. There's no light coming out of the eye. And so when we look inside of the eye from the outside, it looks dark, but it's actually a clear window. It's a gap in the middle of the iris with the cornea over the top, which is the clear window. So we're looking at this structure of the eye now from side on. Here is that same picture of the pupil. This is the focusing lens in the eye. So again, if we think of the eye like an old school camera, the focusing lens that projects the image coming into the eye onto the retinal structure at the back of the eye. The retinal structure we think of as being the film in an old school camera. And there's lots and lots of tiny arteries and veins that spread around the retinal structure at the back of the eye. And so important to note these structures because we'll be talking about cataract, which occurs in the lens, diabetic retinopathy, which happens in the blood vessels, macular degeneration, which happens at the center of the retina, and of course, poor vision that relates to just the eye being out of focus. The first condition that we'll chat about today is age-related macular degeneration. As the name suggests, this is certainly a condition that becomes more prevalent as people get older. And we generally think of this condition being far more common in people being 70 years of age or older. It comes in two forms, dry and wet. And I think the best way to describe macular degeneration is the structure of the retina on the back of the eye. If we think of that like a brick path, well, in macular degeneration, the grout between the bricks crumbles a little and degenerates and deteriorates, and therefore the positioning of those bricks becomes a bit skew-if, and it causes some distortion to vision. Unfortunately, there's a more severe form of macular degeneration called wet macular degeneration. And we can think of that as being like grass or weeds growing through the cracks between the bricks, or in the case of the eye, that's like fine arteries growing through that cobblestone structure of the retina. And unfortunately, those new blood vessels can bleed, which can cause a really significant impact on eyesight. The artist's impression down on the bottom right-hand corner shows an image of two kids, and the center part of that image is blurred out the same way that if someone lost their central vision in macular degeneration would have that sort of impact. I mean, in this photograph, we're fortunate that we can look around that smudge area, but in reality, in macular degeneration, it's like having someone hold, or yourself holding a fist in front of your eye, where you actually can't see anything other than peripheral vision in that severe form. So this has a really significant impact on people's eyesight. So here's an image of a grid that we would often send home with people, particularly someone we think might be at risk of the wet form of macular degeneration. And so the image here on the left is a nice square straight lines of the regular grid. On the right-hand side, we can see the distortion, an area where there's a gap. And so this is a grid that we will often tell people to put on their fridge at home, look at once a week, and if there's a sudden change in those lines, to let us know straight away so that we can be proactive about treating this condition. We've talked about who's at risk in terms of age groups. Certainly, it says here over 50, but certainly people over 70 are at a higher risk than anyone else. People who smoke are definitely at a higher risk. And if you've got family members who've had this condition, then there is certainly some genetic factors in place where it means that you're at a higher risk yourself. As far as, well, what do we actually do about this condition? Well, in that dry form where there's just some small wearing out of the retinal structure, really the only advice that we're able to pass on is to keep a watch on it and let us know if there's sudden changes. And otherwise, dietary advice, making sure you're eating nice, brightly coloured fruit and vegetables, which means that you're getting enough antioxidants in your diet. And protecting yourself from UV light. There's certainly some evidence that UV damage can bring on more macular degeneration. As far as the wet form, which is the form that creates more distortion to vision, we're quite fortunate these days, really for about the last 15 years, there's been treatments which involve anti-inflammatory medication that's put into the eye to settle down the swelling and the bleeding. It sounds somewhat gruesome in that it's actually an injection into the eye, and usually that would happen each 6 weeks until the surgeon was convinced that things had been stabilized. But it can be an ongoing treatment over a year, for example. But as inconvenient as it might seem to have an injection in your eye once every 6 weeks, this has an enormous impact on the eyesight of that person, and quite often means the difference between being independent and not independent. The next condition I suspect a lot of you will be somewhat familiar with. Cataracts really are a fairly inevitable condition that we expect most people to be affected by the age of 80, for example. So it'd be uncommon for me to examine someone who's in their 70s and not have some amount of cataract. We talked about the structure of the eye before. This is the focusing lens. Really the way that the cataract, or the definition of cataract, is this lens goes from being a nice clear structure to becoming a bit cloudy. So the artist impression here down the bottom right-hand corner is of a cloudy image. So similar to what you might think of a dirty windscreen or a dirty window, or looking through a glass of water where a drop of milk has been added to it. So other than a general blurring of vision, and most often this comes on quite gradually, the other impacts are poor night vision because there's less light able to get through that cataract, and more glare sensitivity on bright days. So most of the time when we catch cataract early, we're in a good position to discuss when the right time is to treat this condition. As I've already mentioned, almost everyone by the age of 80 has some amount of cataract, and it's depending on what the lifestyle requirements of that person is and how bad the cataract is would indicate when the right time is to have that treatment done. People who smoke and people with diabetes can have their cataract form a bit earlier. Certainly high exposure to UV light again can bring on cataract a bit earlier, as well as some medications, including corticosteroids. So in the early stages, often the fact that the cataract is forming will change how strong someone's glasses need to be. So in the early stages, often just a change of glasses is enough, and advice on the fact that cataract is there and we need to keep watching it, and you need regular checks to make sure that we know when your vision is getting poor enough to warrant the surgery. And of course, then when the cataract does progress to be bad enough, we refer on to an eye surgeon who fortunately can do the treatment of this these days quite easily. It really is, in most cases, quite routine surgery. It usually lasts only 20 minutes. It's under local anaesthetic. Almost always you're home the same day with an eye patch to wear overnight, and that patch comes off the following day. And then that's really the recovery starts immediately from there, where there's a couple of weeks of using eye drops, and then most often a change of glasses that's required a month after surgery once the eye has healed. The third condition to talk about today is diabetic retinopathy, and as the name suggests, this is a condition that affects people who have diabetes. Retinopathy refers to changes in the retina, and the way that this works is that the really fine arteries and veins that I was talking about earlier on in the retinal structure become more leaky for people who've got diabetes. The artist impression down the bottom right-hand corner really would only relate to someone with quite a severe form of this condition. In most cases, in the early stage, there's actually no visual impact, and then when it gets to a moderate level, there's some general blurring of vision. So this is a condition that we would normally see for someone who's got poorly controlled diabetes or has had the condition for quite a long period of time. So the more out of control your glucose is, and the longer you've had the condition, would indicate your risk of whether you're likely to have these spots of blood appearing around the retinal structure. In those early stages, there's no treatment required, but it's important for us to have that conversation with your doctor. We would send a report back to your GP to say, this is someone who's showing early signs of diabetic retinopathy. This indicates that their diabetic control isn't as tight as what it should be, and therefore they're at risk of vision loss in the future. And it also has a suggestion of how the diabetes control is in the rest of the body. So this is important information for your doctor to receive, to work out how your diabetes control is going. Who's at risk? Well, yes, of course, people with type 1 and type 2 diabetes. It's certainly the people with type 1 diabetes tend to be at high risk because they get their condition earlier in life, often as teenagers. And so by the time someone's 50 or 60 years of age, they've had this condition for 5 decades and are far more likely to show signs of the deterioration of the blood vessels. As far as treatment's concerned, well, we already talked about the anti-inflammatory medication that's injected in macular degeneration. That can also reduce the fluid buildup and the swelling that occurs in an eye with diabetic retinopathy. Laser spotting can also be used to reabsorb the fluid. So terribly important that we find this condition in its early stage. One, to make sure that your doctor can control your diabetes properly, and secondly, to make sure that we get onto it before it impacts your sight. So anyone with diabetes should have a test upon initial diagnosis so that we can take background baseline photographs for future comparison, and then at least every 2 years, and depending on what risk we think that person is of having changes in their eyes, it might be that we see them every 12 months. Very important that people with diabetes do have those regular checks. So your optometrist will have a system in place to send out a reminder note to say when you're due for your eye test. Often your doctor is very good at getting on your back and saying you need to see your podiatrist and your optometrist and your diabetic educator. But this is a third way to have a reminder system in place. KeepSight is an initiative that you can register for, you can put in your details, and then they'll contact you when you're due for your eye test also. So it can be helpful to have 3 ways of having that reminder come into your system. The fourth condition to talk about today is glaucoma. And the importance of this condition is that it really does sneak up on people. I think of glaucoma as a plumbing issue in the eye. There's fluid produced in this area of the eye that circulates around the eye and drains out the front. The purpose of this fluid is to replenish the internal cells of the eye. The trouble is that 1 in 25 adults gets this condition where there's too much fluid being produced, or it doesn't drain away well enough. And so therefore the pressure inside the eye builds up. And if that builds up high enough for long enough, we see damage of the optic nerve at the back of the eye. So again, something that no one's able to see just by looking at the eye externally. And if enough of that optic nerve thinning occurs, then that will actually impact side vision to start with. And the really tricky thing about glaucoma is if you start losing some side vision, it's really difficult to actually pick up that that's happening. The artist's impression down the bottom right-hand corner is someone who would be looking perhaps here in the center of the photo and is getting some blur off to the side of vision. We know in glaucoma that the visual system is quite good at filling in the gap, so that if you were looking at brickwork on a wall, for example, with glaucoma, instead of seeing blackness or missing image, your brain kind of fills in the gap and you feel as if you can see that brickwork. So often it's not until that missing vision comes in enough where you're actually missing half of your vision or you're starting to bump into things that someone would actually notice it off their own bat. And of course, as that vision comes in closer, it becomes very dangerous for someone to drive and not be able to notice that there's someone coming in on the road from the side, for example. So this is unlike cataract, which doesn't matter how bad the cataract is, usually that cataract can be treated. In this case, any vision that you miss from glaucoma doesn't come back. So this is a terribly important one for us to find early. And perhaps the most compelling reason for someone 40 years of age or older to have an eye test every 2 to 3 years, because it's very difficult to pick up those early stages of a condition like glaucoma. So 1 in 25 adults, and particularly people aged 40 and above, and it is a bit more common certainly in the 50s and then in the 60s. It is one that's linked with family history. So if you know of a family member who has glaucoma, we encourage you even more strongly to have a regular eye test. And if you have glaucoma yourself, please tell your siblings and your children and your grandchildren to have their eyes tested, because it's a very key thing to find early. People with diabetes do have a higher risk of glaucoma, but it's something that we should all be aware of. We've talked about elevated eye pressure being a risk factor. There are some people who do have higher eye pressure who don't have glaucoma, but it is one of the key risk factors that we look out for. Certainly there are cases of glaucoma that can relate to an eye injury, and again, people who smoke tend to have a high risk of a lot of health issues, including glaucoma. So as far as the treatment for glaucoma, well, we're lucky that there is easy to administer eye drops these days, which treat the vast majority of this condition. So the most common drop prescribed in Australia is a drop called Xalatan. And the way that one works is it encourages the trabecular meshwork, or filtering of the eye, to open up a little wider so that fluid that's inside the eye drains out a bit more easily. And so that particular eye drop is used once per day at nighttime. And so we're fortunate that although this condition can lead to visual impairment, in most cases, it's treated quite readily through a fairly easygoing system. One of the risks, of course, is people forgetting to use their drops or putting it down their cheek instead of their eye and those sorts of things. So, you do need to know how to use your drops properly, but when you are able to get them in, they generally work quite well. For people whose eyes are resistant to those drops or the drops aren't working well enough, then there are other procedures such as laser and surgery, which actually do open up those drainage channels wider so that the fluid can drain out more easily. So that's the last topic to talk about is the need for glasses. Of course, as has already been mentioned, more than happy to go into more detail if you're interested in any of those other 4 conditions I've talked about so far at the end, and because there may be particular situations that you want to find out more about. So anyway, the need for glasses, you may feel as if this is a fairly innocuous situation. There's no big deal about needing glasses. Why are we talking about that as a health condition? Well, the reality is that worldwide, this is actually the most common reason why people have got vision impairment. Now, that's certainly the case in countries where there's not easy access to eye testing and glasses. But you could imagine that someone who needs glasses to drive, or if they're in a situation where they don't have easy access to that service, then that is a big impact on their life. But I'm sure you are all quite familiar with the fact that there's conditions like short-sightedness and long-sightedness and astigmatism, which cause a blur to vision, and the treatment of that is with glasses. The term presbyopia there refers to the general need for anyone who's 50 years of age or over to need extra help with reading. And so people who didn't need glasses before will generally need reading glasses by the age of about 50. And these conditions do change slowly. So it's not uncommon that we do find people who don't pass a driving standard, either because their condition has sort of slowly come on and they haven't really noticed those changes, and suddenly they're in a position where they don't pass a driving standard, or their glasses are so out of date that they no longer correct them well enough. I've thrown this slide in partly to demonstrate that guy that we all know who says, "Oh, I don't need an eye test. I can read fine if I hold things far enough away." And it may well be that there's a lot of people out there who can get away with cheap magnifiers from the chemist or holding things further away. But what's actually the benefit of being at an age where you start to need reading glasses? It's also the age where a lot of these eye conditions start to become more prevalent. So, you can think of the need for reading glasses as God's way of telling you to go have an eye test done, because it's the perfect time to find out, do you have glaucoma? Do you have a cataract forming? Do you have some other eye condition that's getting the better of you? We also generally say that glasses is a much easier thing to put up with than going in for arm lengthening surgery. So who's at risk? Well, everyone, as you know, there's kids and people in older age brackets. So this is something that goes across all age groups. Certainly, family history does play a part in the particularly short-sightedness, so people who need glasses to drive and see the board and watch TV. The much higher risk in families where parents have had that condition. And we're certainly finding over the last 10 years that there are more kids who are becoming short-sighted because of tendencies for us to spend more time indoors and looking at close-up devices and so forth. So that's not really the topic for today, but it is of interest that we are seeing more need for glasses than we did 10 years ago. Treatment, again, I expect most of you will be familiar with these: glasses, contact lenses, and there's certainly a range of surgical options that we can refer on for people who don't wish to wear glasses or contact lenses. So we've really drummed in the need for a regular eye test. But apart from that, well, what else can you do for good health? And the good news is that the answer is mostly the same as what's good for you otherwise. So no smoking, healthy eating, lots of brightly coloured fruits and vegetables, eye protection if you are in an industry where we're using grinding metal, for example. Also eye protection if you're outdoors a lot, either in a workplace or socially, so sunglasses and UV protection is important. And certainly if you've got diabetes, good management of that diabetes, all of those things are key things that will help out. And unfortunately, the two pieces of advice that aren't so helpful are pick your parents well and try to stay 40 and rather than becoming 70. But so age and family history we can't do anything about. All these other things we can. So some of you may not have even be familiar with what an optometrist does. Fortunately, we can thank Gough Whitlam, I believe it was, who put optometry into Medicare. So it means that it's quite easy and inexpensive to see an optometrist. So the majority of optometrists bulk bill. You don't need a referral from a doctor to see an optometrist. You can contact an optometrist directly. We perform the eye examination. We can prescribe the eye drops that you require. And of course, we prescribe glasses as they're required as well. And we can also refer you to the appropriate eye surgeon if you've got one of those eye conditions that requires a surgeon. So typically in an eye examination, of course, we'll check how many letters you can see on the chart. We'll do a test to see whether you require glasses to see more clearly at distance or at near, and whether that's a practical option for you. And then we do an examination internally in your eye. So we use a microscope to look into the eye to look for signs of cataract. We can do scans and photographs of the retinal structure for future reference. And we do scan around that area to look for signs of macular degeneration and the other conditions that we've talked about today. So just in terms of those additional tests, there are times where we use very sophisticated machinery. For example, behind me, I've got an $85,000 3D camera that looks for the level of macular degeneration. So the original eye test almost always with your optometrist is bulk billed, and certainly that's the case in our clinic. But have a chat to your optometrist, because it might be that there's specialised tests that they will recommend that there may be an out-of-pocket fee for. But that's something you can ask about either on the phone when you call, or in the examination before that procedure goes ahead. How do you book an eye test? Well, if you know an optometrist already, you can book direct. You can ask for a recommendation from a family member or a friend, or certainly, mostly you'll have doctors who refer to optometrists a lot, and so they'll be able to give you advice on who they would suggest that you go and see. But the good news is that there's optometrists all over the country. I mean, in certainly very remote areas, sometimes it can be more tricky to find an optometrist nearby. You can see the website there down the bottom of the optometry.org.au, find an optometrist, and I'll just flick over to the next slide to show that page. And this is a particularly helpful website where if you'd like to find out, well, which optometrists are nearby you within a certain radius, and this can be particularly helpful for people who've got particular language requirements, where you can find someone who's able to help you out, or if you're doing this on behalf of someone else who's able to help with certain languages. So we've talked a lot about the need for an eye test and the importance of being tested on a regular basis. We certainly know from last year that quite understandably, a lot of people held off on having their eyes tested last year during lockdown periods and fear of going out into the community. Otherwise, we know that there's other reasons why people might have eyesight issues. So I'm going to now, oh, here we go. The poll is up. Excellent. Thank you. Thank you, guys. And so we're interested to know, well, what is it that would hold you back from having an appointment? Maybe it's because you feel as if, well, nothing's wrong. I don't need an eye test if I can see properly. You might think that it's an expensive thing to do, or the optometrist is too far away. So it'd be great if you were able to click on one of those options now. If you think, and even if you have been seen by an optometrist in the last 12 months, it would be interesting to know, well, what do you think is the barrier that might hold you back from having a regular eye test? And I'll leave that voting panel up for a moment while your votes are being collated. And while this poll's going, also think about if there's any questions that you might have for us once we get to the end of our talk. We certainly do have time for questions. So we're happy to stay online until 2 o'clock for anyone that's got something of interest that they'd like to have a chat about. Now, I wonder, panelists, whether we've got any results there. And that's probably those results would be as I would have expected. It's, of course, not all of you will have put in your vote, but the idea of being too busy or got other things going on and everything seems okay for now. And just looking at what the other results are. Yeah, and I can certainly appreciate the concern about having to see someone new and wondering whether you're going to have a good relationship with them. So there's definitely benefits in finding an optometrist and then seeing that same optometrist over a long period of time. It's a bit like seeing a regular GP. Someone who can actually compare results over time is a big advantage. Now, of course, we will always see new patients, and it's more important that someone has an eye test done rather than seeing the same person all the time, but a consistent optometrist is definitely an advantage. Being worried about cost, again, is understandable, but I'd certainly encourage you to know that you can ring any clinic to ask about any out-of-pocket expense. And in our situation, it would be the optometrist who's bulk billing you that would inform you of any cost that may be incurred if we decide to go ahead with any scans. So when should you have your eyes tested? Really, the basic answer is if you're 40 years of age or older, every 2 to 3 years. Often by the time people get into their 60s and 70s, we're requesting that they come in more regularly. But I guess unless you've been told to come annually, that you should at least be coming in every 2 to 3 years. And that's so we're talking about age-related conditions today, but with that, really that advice also goes for people or for children and students, that we should be seeing children every 3 years as they go through school and university. As far as low-cost eye services, this is something that's worth talking about. There were a few respondents who said they were aware of the potential cost of getting an eye test. So we're fortunate in Victoria that we have the Victorian Eye Care Service. And as our clinic, Graham Hill Eye Care, we are part of this service where there is a Victorian government subsidy of the cost of glasses. So anyone who holds a pensioner card or a healthcare card is eligible for low-cost glasses. And for example, a pair of straight reading glasses can be as low as about $45 through that system. And so if you're in Melbourne, then the service is available at the Australian College of Optometry in Carlton on the corner of Keppel and Cardigan Streets. And if you'd like more information on that scheme, you can look up the website there, aco.org.au. And of course, you can ring any optometrist and ask them if they are part of this scheme, or indeed what cost structures they've got in place for glasses. We're also fortunate that there's a particular subset of this scheme for Indigenous Victorians, and so this is available every 2 years for anyone who identifies as being Indigenous, as being able to receive $10 glasses through this same subsidy program. And so this is certainly something that the Victorian government has identified as one of the significant barriers to Indigenous health, is the concern about potential cost. And so that has certainly allowed us to see more people in that category. If you do hold a Veterans Affairs Gold card, then people with that card are eligible to have glasses covered by DVA, again on a once per 2 year basis. Certainly important to talk about COVID-19. We've certainly had a year to get used to how to manage this situation. I'm not wearing my mask at the moment, of course, being as part of this webinar, but we're now, as a professional association, we're very aware of what requirements we need to do to make sure that people are safe when they come into our clinic. So it means wiping down anything that has been touched or breathed upon, and that people need to wear masks and sanitize their hands, of course. So if you've got any concerns about how we're playing our game COVID safe, then again, contact your optometrist. But this is something that we are quite confident and well drilled on how to manage. Other support services are worth talking about, and these are support services particularly for people who already have poor vision that is no longer treatable by optometry services. And so Guide Dogs Victoria and Vision Australia are specialist services who look after people who no longer have, or who do have untreatable vision impairment and require extra care. So I think the key message has been said plenty of times, but I'm going to say it one more time, and that is that don't wait for your eyesight to change before you have an eye test. Come in on a 2 to 3 yearly basis, and more regularly if your optometrist thinks you're at risk of problems happening within that period of time.
Thank you, Mark. That was
Thank
really
you.
great.
Thanks, Jackie.
Thank you. A very informative and interesting presentation. So we will take some questions shortly. So if you have any questions, you'll see at the bottom of your screen, there's a Q&A box. So please put your questions into the Q&A box. So if you are on social media, for more information to keep in contact, we are on Facebook. So please follow us on Facebook. And of course, we have a website, thevisioninitiative.org.au. It's coming up now. So if you visit that website, we have resources in 11 different languages, which is fantastic. So please visit the website for more information. Okay, so we will head to the Q&As now, Mark. The first question that we have is that someone is commenting that they notice black spots floating in their vision, and they're wondering if this is something they should be worried about.
I'm just going to go back to my diagram. Thank you. That's a great question, Jackie. So this is a really common symptom, Jackie, that we would have someone coming in attending almost every day with this symptom. If we look back at that picture of the eye, the internal part of the eye is filled by a clear jelly. So these pictures of the arteries and veins, you can actually think of those. Actually, I've got my model of the eye here. So that they actually sprout around on the edge of the eyeball. But in the middle is this clear structure called the vitreous. And that vitreous structure condenses down and shrinks over people's lifetimes. So what will happen sooner or later is the lining between that vitreous and the retina will separate, and little protein fibers will come away from the retinal structure. And so they float around inside the eye. Often people refer to them as a hair or a cobweb or an insect. And generally, if you move your eye across, they kind of move across with you. They're generally more visible against a blue sky or a bland white wall. I get a few of these myself, and I tend to notice them more when I'm a bit tired. And so that's your visual processing not being as good at ignoring that useless information. Fortunately, the majority of these are harmless, but probably about 5% of these symptoms relate to a tear in the retina, which can lead on to a retinal detachment, which really means the retina starts falling away from the back of the eye. And that can cause a significant impact on vision and indeed blindness. So anyone who starts noticing new floating spots in front of their eyes should absolutely attend as promptly as practical to go and see their optometrist. Most of the time we're able to inform, yes, you've got the harmless variety. If we do find a retinal tear, then we need to refer off to a surgeon really promptly to have that treated. One of the symptoms that tends to go along with people who've got more likely to have a tear in the retina is flashing lights. Now, that doesn't always mean there's a tear in the retina, but that is certainly another symptom that would indicate that you should go and see your optometrist really quickly. Certainly a gap in some part of the vision is an indication that the retina has already come away in that area. So that would mean going in as soon as you possibly can. So that's when we see someone with this symptom, we would certainly be putting eye drops in their eyes to dilate their pupil. We'd be photographing the retinal structure and identifying if there's any concern. Usually we'd see that person again a couple of months later to make sure that things have stabilized if they are in that harmless situation. So I hope that answers the panelist's question, Jackie.
Yeah, I think that's a great answer. Thank you, Mark. The next question is from someone who has to regularly use eye drops, and they have a bit of trouble because of the arthritis in their hands, and they're wondering if you have any tips for using eye drops. They also say they often get more than one drop in. So just any tips on using eye drops and anything in particular with the arthritis in the hands?
Yeah, sure. Certainly you can go to a chemist, and often they do have devices like an easy squeeze device that the eye drop bottle can go into. As far as 2 drops versus 1, well, you don't necessarily want to use up drops quicker than you have to, but it's really rare to cause problems by putting a second drop in an eye. So if you've got a condition that requires eye drops, two drops in the eye is far better than none. So that my encouragement would be to worry less about the 2 drops and make sure that you actually get the drop in. I'm not sure how well you can see me on the camera here. My personal favorite technique of putting eye drops in without those devices that I was talking about, just to make sure it actually goes in the eye rather than down the cheek, is to hold a fist against your cheek and actually then watch where actually have the eye drop right in front of your eye. So that way, when you lean backwards, you know that eye drop bottle is right above your eye. So that way, instead of holding a bottle up here and aiming like you're trying to shoot a target from 20 meters away, having the fist on the cheek and then holding the eye drop right in front of your pupil, and then you can look away when you put your head back. But that means that you know that you've got that eye bottle lined up quite well.
Thanks, Mark. That's great advice and a good little demonstration. Thank you. The next person is commenting that their eyes often feel gritty, like there's some sand in them, and that they water quite a lot when they're like playing golf when it's windy conditions. So just wondering what causes that and if you've got any tips to help prevent that.
Yeah, absolutely. So these are super common symptoms of dry eye. And interestingly enough, people who've had to wear masks over the last 12 months, there's actually a new syndrome referred to as mask wearing dry eye. And so this is where by wearing a mask, the extra airflow that tends to blow up underneath the mask, that airflow against the eye will dry it out. But this is also really common for people who use computers a lot or do a lot of reading. When we're engaged in that type of work or recreation, we stare more, our eyes blink less often, and that allows the moisture content on the eye to dry out. Around air conditioners or wind, that airflow will evaporate the moisture that's on your eyes, and that will again cause that dry, gritty, sandy kind of feeling. So in terms of mild dry eye, that's really just exacerbated by those type of situations, using eye drops as required and wearing, when you're outdoors, sunglasses, particularly wraparound sunglasses that stop the airflow going against the eye, is helpful. Driving with your air conditioner not pointed at your eyes but pointed away from you is also helpful. But there's also lots of people out there with more significant dry eye conditions where just those basic tips aren't enough to keep their eyes comfortable. So there's lots of different techniques, such as warming up the glands around the lids, or using omega-3 based tablets. So there's lots of treatments that can be applicable to certain types of dry eye. So we really would need to see that person to work out what the best management is, if just basic drops and sunglasses aren't enough.
Okay, great. Thanks, Mark. Another person has commented that they're a bit confused after seeing the optometrist because they got told that there was something wrong with their eyes, but they weren't really given many details. Mm-hmm. So they were told to go back to their doctors, who I'm assuming they're talking about their GP, but the optometrist hadn't written a report to the GP. So the GP didn't really address the question and sort of ignored it because they didn't know what the issue was. So if you've got some advice on how this person should tackle this issue?
Yeah, certainly. So it sounds as if that person should go back to have a chat to their optometrist again, and say that I felt like the situation was a bit rushed. Can we talk about this at greater detail? And they're certainly able to request the optometrist then to report on to the GP. Of course, if they didn't feel as if they were satisfied with the outcome of that examination, they may want to get a second opinion from another optometrist. They may want to ask around if they feel as if that practitioner was a bit rushed in the way that they do things. But I would say the first port of call would be speak to the optometrist again and make sure that you get a clear message on what the advice is. And particularly if they felt as if that person should go back to their doctor, then absolutely there should be a report sent in that situation.
Yeah, totally agree. Thank you. Another person is asking about irritation from hay fever. Mm-hmm. Where you end up with red eyes.
Yes.
So what can they do to help deal with that?
Yeah, there's normal, what we'd call standard seasonal allergic conjunctivitis, which is basically hay fever that affects the eyes. And there are a number of over-the-counter antihistamine drops available that are quite effective these days. My favourite is Zaditin, which is a combination drop that has an antihistamine and a mast cell stabilizer, which means that the histamine is taken away, but also by the mast cell stabilizer means the histamine is not released in the first place. So these are drops which become more effective the more days in a row that you use them. So these tend to be more effective than the older antihistamine only drops. The combination drops are certainly more effective. There are certainly people that we see with really quite swollen and quite acute uncomfortable red eyes, where we need to give a prescription for more significant anti-inflammatory action. And so if that person just has a bit of mild itchy irritation, then they can try some of those over-the-counter eye drops. If they have a more significant issue, then they should see their optometrist, because it might be that at least for a short period of time, they might be better off having prescription eye drops.
Yeah, okay, great, thank you. The next question is, and I'm sure you get this quite a lot, is does wearing glasses make my eyes lazy?
Yeah, absolutely. And this is something I really enjoy talking about, because it's a really important thing for people to know that the answer is no. There's really sensible reasons why that old wives' tale has come about. That usually when people get to the age where they need their glasses, then they're, a couple of years later, they think, oh gosh, my eyes are worse, therefore it must be the glasses' fault. Whereas, the condition they had in the first place that meant that they needed to wear glasses has continued on. So there's that situation, and also the fact that when people start wearing their glasses and become aware of how sharp things can be, it's actually a more dramatic reminder when they take their glasses off. Gosh, was it really that bad? And so I tend to compare it to going from an old TV to a new flash ultra high definition widescreen TV. You go back to the old one, you think, oh, was it really that bad? And of course, you just get used to things being better. So almost always, this is perhaps with the exception of certain lazy eye conditions in children, but as adults, almost always it has no impact on what happens to your eyesight 4 years from now, whether you wear the glasses a lot or just on and off. So in most situations, it's up to the individual to decide when do they want to wear their glasses, but not to be fearful of trying to not wear them because they're worried that wearing the glasses is going to make their eyes worse.
Yeah, and I like that analogy with the new and old TV. That's good. The person who asked the question about the hay fever has just sent a follow-up question. If you can't take medications, is there any ways that you can suggest to protect your eyes from sort of getting the pollen in your eyes in the first place if you can't take medication?
Yeah, I mean, you'd have to have a chat to your pharmacist. It's uncommon for people to be unable to use the eye drops, the anti-allergy eye drops. For people who do respond to preservatives in eye drops, there are in fact preservative-free versions of that drop also. But the best way to avoid pollen getting in your eyes otherwise is wearing sunglasses. So other than just not going outdoors, which is we've learned over lockdown periods, there's not necessarily a whole lot of joy in that lifestyle. So it really is an environmental factor. So the only other way other than using drops is to avoid having the allergen touch your eye, and that's by either not being outdoors or wearing sunglasses.
Okay, and the person who asked the question has sent a thank you with 3 exclamation marks. I think they're very pleased with your answer. So that's all the questions that we have had come through, Mark. So thank you. We hope that you enjoyed the webinar and that it encourages you to have regular eye tests and make eye care part of your regular healthcare regime. So thank you for joining us, and goodbye for now.
Thanks, everyone. Really appreciate the opportunity to have this important chat, and thanks to the Vision Initiative.
Thanks, Mark. Thanks, Nicolette.